afternoon, and thank you for joining us for today's virtual media briefing about COVID-19 in London and Middlesex County. We're glad to have you along with us. Also happy to be joined this afternoon by the Mayor of London, Ed Holder, the Warden of Middlesex County, Alison Warwick, the Acting Medical Officer of Health at the Middlesex-London Health Unit, and the Executive Vice President and Chief Nursing Executive at London Health Sciences Centre, Carol Young-Ritchie. Thank you also to all the members of the media who are in attendance this afternoon. And we do have a few questions in the queue, but we could use some others. So if you have not yet submitted a question, just click on the question mark in the text bubble here on Microsoft Teams. And when you do, if you could indicate your name as well as your media outlet and who your question is for. And finally, a welcome to those who are tuning in this afternoon on Rogers Television, as well as the Rogers Facebook page and YouTube channel, and those who are following us on the CTV London website. Let's get to our opening remarks right away, and we'll start today with Mayor Ed Holder. Mayor Holder.
Well, thanks, Dan, and good afternoon, everyone. As has been the case over the last few weeks, our slow yet steady stream of positive indicators, it continues, even as the economy continues to reopen and people return to some of their favorite activities. Now, over the last week here in London, we've seen hospitalization rates drop by some 20%, while similar trends are being observed right across Ontario. As previously mentioned, just because things are better doesn't mean we're in the clear. Infection rates remain exceptionally high, and so it's important that everyone be honest with themselves when it comes to monitoring for symptoms. So, if you're not feeling well, please stay home. I'd also like to recognize and acknowledge the great work done by a number of City of London staff over the weekend, particularly members of the London Police Service, for ensuring that a convoy-style protest in our city was brief and orderly. You know, through the pandemic, we've had multiple protests here in London, and whether one agrees or disagrees with the cause, I think most everyone respects and understands the right to protest. Well, what's happened in our city over the weekend and the right to protest peacefully is, well, that's part of what makes ours the greatest country in the world. What is not happening right now in our nation's capital, where what might have started as a protest has now since devolved into an outright occupation. My heart goes out to the Ottawans, the residents, the businesses, especially those in the downtown, where much of the incessant noise and harassment is taking place. These individuals with their so-called freedom protest, well, they're spreading fear. They're keeping businesses closed, and they're scared, and they're scaring people into staying at home. It's obvious to most anyone that restrictions are in the process of being lifted. And there's going to come a time, in the near future where nearly all public health measures are rolled back. And when this happens, all the credit belongs not to those who are occupying our nation's capital. Rather, the credit will be due entirely to those who have made the sacrifices for the greater good, those who have gotten vaccinated, and those who for the last 2 years have thought of others besides themselves. So in the meantime, it's my sincere hope that people in Ottawa will soon be liberated from those who claim freedom as their cause, despite spreading nothing but oppression, misery, and fear. Well, that's it for me. So let me turn this now over to Warden Warwick, please.
Well, thank you, Mayor Holder, and good afternoon, everyone. It was great to see the news coverage of the Middlesex-London paramedic services this weekend. Once more, Miranda Bothwell and her special operations team were assisting in pop-up clinics in London locations. The value of bringing vaccines to residents that have not been able to easily access vaccines elsewhere is to receive a shot where you're familiar and comfortable is often the deciding factor to get over vaccine hesitancy. At this time, the clinics are able to offer both Moderna and Pfizer vaccines. Chief Roberts and our paramedics wish to thank you for all of your support from the public throughout COVID. Although numbers are starting to improve, it's still important not to let our guard down. We know the virus is still active, and through my observation of my own social media, there's still lots of posts from friends and family where recent infections are reported. Just a reminder from our first responders, if there is an emergency, please call 911. However, if not an emergency, call your doctor or attend a walk-in clinic. The ambulance call volumes still remain high, and in order to keep our population safe, use 911 for emergencies only. Also, and when you see an emergency vehicle, please pull over to the right and stop where possible. If you're out in the county and see green flashing lights on a vehicle, please pull over in the same fashion. These are the lights used by our volunteer fire departments, and the green lights mean that they're responding to a call or heading to the fire station. I hope you're able to enjoy the sunshine we had on the weekend and even participate in some winter activities. If you're planning to stay inside, remember our Canadian athletes would love to have your support. These Olympic Games are proving our athletes to be great ambassadors for our country. Let's keep those medals coming in the days ahead. Thank you.
Thank you, Warden Warwick, and thank you, Mayor Holder. And thanks to those that are joining us this afternoon. We continue to see case counts gradually decline in our region, and yet those case counts remain higher than any other time during the pandemic, even as they are an underrepresentation of the total amount of COVID-19 transmission we're seeing in our community. We should take those positive trends and celebrate them, while also recognizing the ongoing work that we must continue to do in order to limit the stress on our healthcare system and consequently see a rollback on the public health measures that have been frustrating us for so long. The best course of action for us is to get boosted. And for anybody who's not yet received their booster dose, I want to invite you to do so as soon as possible. The booster dose is safe. It is highly effective against preventing infection from the Omicron variant, and most importantly, protecting you against severe illness and hospitalization. No vaccine is perfect, and certainly there will be folks who've received 2 doses of the vaccine or who've been boosted who may end up contracting COVID-19. However, the booster dose is the single best chance you can give yourself and your community to reduce the transmission of COVID-19. As the public health measures are rolled back and as things start to return to normal, we risk seeing a resurgence in cases. What can help us most importantly is the booster dose. And so if we can see a dramatic increase in ongoing boosters over the next 3 to 4 weeks, we will position ourselves even better as a region and as a province for continuing our favorable trajectory and seeing a reduction in COVID-19 transmission in our community. It's never been easier to get vaccinated. All of the mass vaccination sites in the Middlesex and London region are open for walk-in appointments. You can book an appointment very easily. If you want to get boosted, you can get boosted today by walking into any clinic or by booking an appointment at any time this week. Vaccinations in our region also continue to offer vaccine, in addition to our expanded mobile efforts. You heard from Warden Warwick the critical work that the Middlesex-London Paramedic Service is doing to support mobile clinic operations. The Middlesex-London Health Unit is also collaborating with MLPS to provide operational and mobile services. We were in schools last week in the late afternoon, early evening to provide community hub clinics for vaccine. We've added 6 additional school clinics over the course of February and more to come. You can check out that schedule on our website at healthunit.com. Our objective with our mobile outreach is to make sure that the vaccine is available close to home in neighborhoods where vaccine uptake may not have been as high. We strongly want to make sure that people have access, be it for their booster or for particularly those 5 to 11-year-olds for their first and second dose. I want to remind parents and guardians of young children that the vaccine is safe, it is effective, and it is readily available for you. Please visit one of our mobile clinics or visit a mass vaccination site, and you can ensure that your child remains protected and that our community remains protected as well. It is great to see our public health measures effectively reducing the burden of COVID-19 in our community, but we're not out of the woods yet. And so in order to make sure that we continue on this trajectory, booster dose remains our objective in the name of the game. With that, I'm going to pass things on to Carol Young-Ritchie.
Thank you, Dr. Summers, and good afternoon, everyone, and thanks for having me here to share the COVID-19 COVID-19 situation at London Health Sciences Centre. As of this morning, we're caring for 119 COVID-19 positive inpatients, and we have 25 patients in critical care. Our children's hospital, there have been fewer than 5 inpatients with fewer than 5 inpatients in our children's hospital and fewer than 5 in our pediatric critical care. With our critical care numbers remain relatively steady, we are beginning to see a reduction in the volumes of patients who require acute care. In keeping with that positive news, we have continued to resolve some of our outbreaks. And with our outbreaks, with four remaining of the original cluster of 12. This includes 3 at University Hospital and 1 at Victoria Hospital. I'd like to thank our team for their diligence in following enhanced protocols and ensuring we are doing everything we can to contain our outbreaks and resolve them as quickly as possible. I'd also like an opportunity to thank our community for the show of peaceful support outside Victoria Hospital this past Saturday. Your support certainly helps to boost our spirits during these challenging times. Thank you. Lastly, I'd like to take a note that we've received an amended Directive 2 from the province, which directs us how limited service in specific areas may gradually be resumed. These areas include pediatrics, diagnostic imaging, cancer screening, and some of our ambulatory care clinics. We are currently finalizing plans of how we can implement these amended directives at LHSC, and we've had in previous waves, and we are carefully balancing our ability to resume these services with our occupancy pressures and availability of our health human resources. As always, our focus remains on providing our patients with care they need in a timely manner as possible. We are committed to working with all our program areas to find a balance between working through the backlog while preserving enough capacity to respond to urgent cases and any further potential spikes in COVID-19 cases requiring hospital care. Thank you.
Thank you, Carol Young-Ritchie, Dr. Alex Summers, Warden Warwick, and Mayor Holder. We do have a number of questions, and thank you to the media who sent them along. Let's get to those right away, and we'll start this afternoon with a question for Dr. Summers from Jane Sims at the London Free Press. Dr. Summers, today was one of the few days in the past couple of weeks where there weren't any deaths reported. The case counts appear to have fallen dramatically as well. Can you give some sense of how much Omicron is still in the community and whether we could see an earlier loosening of restrictions?
Thanks for that question, Jane. Certainly, it is encouraging to see the decline in the case counts that are being reported each and every day, as well as see a slight decline in hospitalizations and the number of deaths as well. However, as highlighted, these case counts remain remarkably high. We're reporting over 100 cases today, and I want people to think back to October of this past fall and reflect a little bit on what it would have been like if we had reported on that day 100 cases and what that would have felt like. It is remarkable how perspectives and perception can change. That 100 cases also represents an underrepresentation of the total number of cases in our community because only certain people can get tested right now. Therefore, it reflects just a fraction of the people who are likely experiencing COVID-19 in our community. It remains the fact that we still have more COVID-19 in Middlesex-London than at any other point in time in the pandemic. However, it is heading in the right direction. But that's why I speak so strongly about the need to continue to protect yourself and your community through masking, reducing your social contacts, keeping your activities outdoors, and most critically, getting boosted as soon as possible. For those under the age of 50, we are still less than 50% who've been boosted. That number is less than 40% for those under the age of 40. That's too low. And again, when we have a safe and effective tool that will readily protect you from the worst of this brutal infection, I really want to strongly encourage people to take advantage of it. I know for some there's concern with regards to the side effects associated with this booster dose. For some folks during their first and second dose, they may have experienced fatigue or even a fever or chill in that first 24 to 48 hours, and that's true. However, I can tell you, it is remarkably better than getting infected with COVID-19, as anybody can attest. And that third dose, even if those side effects last you 24 to 48 hours, are dramatically better than the significant symptoms that you may, even if you don't have to go into hospital, experience from getting infected with COVID-19. So even as we look at the sense of optimism with the longer days and the sunshine and the hope that maybe we are on our way out of this, we still have significant Omicron transmission, regrettably. And so it's critical that we continue to boost and protect ourselves. In terms of an earlier loosening of restrictions, I do not think that that's in the cards. I think the 21-day interval between restrictions being expanded is critical for us to fully understand the impact of rolling back restrictions. It takes a week, 2-3 weeks to see the impact of these types of measures or the reduction in these types of measures. So I would strongly hope that the province maintains its gradual and evidence-based approach to reopening so that we don't see a sudden resurgence and that we can adapt to any resurgence that does happen. Thanks, Dan.
Thank you, Dr. Summers. Let's go to a follow-up from Jane. Dr. Summers, Jane would also like to know whether there has been any significant uptake in children's vaccinations since school went back full-time.
Thanks for that question, Jane. Amongst 5 to 11-year-olds, we've seen a significant slowing in uptake of vaccine. I think we will likely see incremental growth in vaccine coverage amongst this population over the next short while. Our hope is through our school-based clinics to provide easier access for parents and guardians who are not able to get to a mass vaccination clinic site. Our community hub clinics based in school are walk-in clinics where parents and guardians can come right after school to a location in their neighborhood in order to get their child vaccinated. We don't vaccinate kids without parental consent. We don't vaccinate 5 to 11-year-olds at this point without the parent present. We want to be clear on that. But what we do is provide an easy opportunity for parents and guardians to have their child vaccinated with them present. I hope that we will continue to see growth in vaccination coverage. I think what we are hearing slowly from parents and guardians is that January and the beginning of February has been a stressful and busy time, and that getting out to get vaccinated has not always been chief of mind. Our hope is that by providing these increased opportunities that it can become an easier thing to do. The vaccine continues to be demonstrably safe and effective in 5 to 11-year-olds. The National Advisory Committee on Immunization in the last few weeks changed its recommendations regarding the vaccination of 5 to 11-year-olds from may be vaccinated to should be vaccinated. A subtle change in wording and yet a substantially impactful one. The more kids we vaccinate, what's becoming clear is that we are increasingly confident that this vaccine is safe. The benefits remain clear. The safety is growing in clarity. This vaccine is safe and effective, and we hope parents take every opportunity they can to get their child vaccinated.
Thank you, Dr. Summers. Let's go to our next question. It's from Dan Brown at the London Free Press. And Dr. Summers, this one is for you as well. And maybe Carol and Young-Ritchie, this may also warrant some input from you. So here's Dan's question. How significant is it that COVID hospitalizations are down today? If I'm reading the update correctly, on Monday, LHSC was treating 119 COVID patients, down from 139 3 days earlier. How big of a deal is that? And I know it's for Dr. Summers, but I wonder if we go to Carol Young-Ritchie first. Alex, are you good with that?
I am. Well, let's hear from Carol.
Sure. I can start that one out. We're happy that's going down because that allows us to open up more of the some of the work that we put on hold. So as I talked about the amendment of Directive 2, that was asking us to stop down to emergent and urgent cases. So with the numbers going down, we can slowly look at reopening some of our services and begin to tackle our backlog. So we are cautiously optimistic, and we're going to be ready whichever way this goes, but we're certainly happy that the numbers are coming down.
Dr. Summers?
Thanks for that, Carol. Specifically to Dan's question, how big a deal is this? It is an encouraging deal, but it's not a surprising one. We're now 2 years into this, and we know what follows an increase in case. counts, and we know what follows: a decrease in case counts. With the Omicron wave, because of the vaccination coverage, what we didn't know was how much hospitalizations would go up, but we knew they would go up, and they certainly did. Our healthcare system was strained. And I think I want to remind people that our healthcare system was also, in fact, overwhelmed. The reason we know it was overwhelmed is because the only way we could keep things functioning was to stop critical services, surgeries for people with cancer diagnoses, care and ambulatory support for people not with mild health syndromes, but with severe illness. That means the system was overwhelmed. And so I think we have to acknowledge the significance that the Omicron wave had on our health system's functioning and the tragedy associated with the reduction of services as a result of the COVID-19 wave, not just because of COVID-associated deaths, but because of the deferral and delay in critical care and services. Our system was overwhelmed. And therefore, it was absolutely essential that we did what we did with regards to public health measures. If we had not done them, things would have been so profoundly and tragically worse. I'm encouraged to see those hospitalizations drop, but we got a long way to go. And those hospitalizations dropping certainly are consistent with what we've seen with a drop in cases over the last little while. It is always a lagging indicator, but let's remember this. If we see cases continue to go up in the next number of weeks, that unfortunately, the predictability of what will happen in hospitals is no longer a surprise to us 2 years out. When cases go up, so too do hospitalizations. So let's remember that when we're reflecting on what could happen if cases go up. And let's remember that when we consider the delays that we continue to see in booster dose coverage. We want our hospitals to be able to continue to reopen and provide the critical services to our loved ones. We get boosted. We want to be able to roll back public health measures so that we can participate in the activities we love and enjoy the freedoms for which we celebrate. We get boosted. That's our pathway out. And so I am so encouraged by the ongoing decline and stabilization in hospitalizations, but let's not remember the predictability of how we got there and what happens if case counts go up again and we don't, as a community, continue to get boosted and vaccinate all of our community members. Thanks, Dan.
Thank you, Dr. Summers. Let's go to the next question. It's from Angela McInnes at CBC London. And Dr. Summers, this one is for you. Dr. Summers, now that the numbers are on the decline, can rapid tests become more widely available to the public again?
Thanks, Angela. The distribution of rapid tests will be something I think we may see changes with regards to over the next little while. The rapid test capacity has really been critical to maintain critical staffing numbers for our essential services like healthcare and city works, et cetera. Rapid tests, of course, play a critical role when used in a systematic and continuous way. When they're used in a one-off manner, it is hard to know how significant they are at preventing transmission. The province and the federal government will have a better sense of exactly the stream of rapid tests available in our region. As a health unit, we don't have direct line of sight on that, so we'll watch the province and the provincial announcements more closely to determine how those tests may be distributed to the general public.
Let's go to our next question. Thank you, Dr. Summers. The next question is for Mayor Holder. It's from Dan Brown at the London Free Press. And Mayor Holder, you spoke about this a little bit during your opening remarks, but Dan Brown asks, Mayor Holder, there was a rolling protest in London Saturday in support of the Freedom Convoy encampment in Ottawa. How satisfied are you with the response Saturday from police, from ordinary Londoners, from the anti-mandate protesters themselves?
Well, thanks, Dan. I'd like to unpack your question because as much as it's one long question, there's actually two parts to it. First, I absolutely reject the premise that this is a freedom convoy. How dare they call that freedom? Encampment is correct, but it is not a freedom convoy. Look, we can't let the small minority control the dialogue. I will not have the siege in Ottawa that one calls a freedom march and a freedom convoy be considered by any name except what it is. It's a siege. It's an occupation. And how dare we compare occupation that we see in Ottawa, where business people and individuals are effectively captive and not with freedom. To me, those who are involved are displaying absolutely disgraceful conduct. As far as the second part of your question, which relates to the convoy, all the information that I have through police and through our own city staff, and I need to compliment them both again, is that this protest, this anti-vax protest, which is what it truly is, was orderly. They came up Wellington, went through parts of London and left. And good, they're gone. But I would say to you that they did exactly what they said they were going to do, and frankly, look, we have always said we believe in the right of peaceful protest, and that appears to be what it was here in London, Ontario. So again, thanks to police, thanks to our own city staff for keeping that organized, and also to Londoners themselves for not making this more challenging than it might otherwise have been because of our frustration, where 90+% of Londoners are doing the right thing. You know what I'd rather talk about? I'd rather talk about those folks who were in front of London Health Sciences and said bravo, and said thank you for caring, thank you for keeping us safe, and thank you for taking care of that small minority who frankly don't care about the rest of us, and they're the ones that end up in hospital. Isn't that bizarre? There's just no logic or sense to this. But to all our professionals, be they frontline workers, be they folks who are serving food to the folks inside the hospitals, to the folks that clean up, all of the folks who are involved with our hospitals, our heartfelt thanks.
Thank you very much, Mr. Mayor. I do have a couple of follow-up questions from Dan Brown for you. The first, Mayor Holder, have you received any requests for any kind of assistance from authorities in Ottawa? Has anyone reached out to you? And then a second question there, would a request for help from London Police go through you, or would it be a police force to police force request?
I'll answer those collectively, Dan. Firstly, that would typically be police force to police force. I have not received specific requests from the Mayor of Ottawa, although I did call the Mayor to extend our support to the issues that he and his council and his police are dealing with. I am aware through the Mayor that of Ottawa that our London Police Force was contacted by theirs, and we are providing some supports for crowd control and the like in Ottawa.
Thank you very much. Let's go to our next question. The next question is for Dr. Alex Summers. It's from Hannah Alper at the Western Gazette. Dr. Summers, how do you feel the return to campus plan is going in terms of Western University students? Do you still feel confident about first-year students returning to campus in in-person classes at the end of February?
Hi, Hannah. Thanks for that question. So far, so good, I think, would be the name of the game when it comes to the return to in-person learning, both for primary and secondary schools, but also for post-secondary institutions in our region. Critical to all of this is to remember the key infection prevention and control steps that have been taken in our post-secondary institutions to minimize the risk of transmission in those sites. Things like ventilation, masking, requirements for vaccination. These steps are absolutely essential. It is also essential to remember what's also in the hands of students outside of campus when you're at home, when you're hanging out with your friends, keeping your social circle small, making sure that you are encouraging vaccination amongst your peers is also a way to ensure that the return to campus is as safe as possible. We're still not in a place where the post-secondary experience, the student experience, is the same that it would have been prior to the pandemic. Socialization looks different, needs to look different, and that will be what will ensure a safer end to this semester and a safer return to campus. With regards to first-year students returning to campus at the end of February, certainly the signs are encouraging at this point for the general community and the province to support that type of return. And again, those critical infection prevention and control steps will help make sure that that return is as safe as it can be. Thanks, Dan.
Thank you, Dr. Summers. And we have one last question in the queue, and it's a follow-up from Hannah Alper at Western Gazette. What data are you looking at, Dr. Summers, to make the decision you're doing? And has the data changed in the last week or two to make your decisions firmer?
Thanks for that question, Hannah. The decisions, just to be clear, around public health measures are almost exclusively made at the province under recommendations from public health authorities, in particular the Chief Medical Officer of Health. And so the timelines for the reopening and the restrictions placed on places like post-secondary institutions like Western are made through the province. The local public health units like us, we support post-secondary institutions with guidance, specific details, and ways to make within the provincial context the safe or the return to campus or the functioning of education in our community as safe as possible. And so the metrics that we watch to try and inform the guidance we provide is based off of things like the trends in case counts, the trends in percent positivity, hospitalizations, outbreaks in vulnerable settings. These are all things that help show to us what the trend of COVID-19 is in our community. The other thing we look at, of course, though, is vaccine uptake, as well as the emerging evidence around the effectiveness of the vaccine in disrupting transmission and preventing severe outcomes. Those are the things that we look at. What is clear, and you've heard me say this multiple times today, the booster really improves your personal protection against getting COVID-19. Likely taking your protection with just 2 doses from somewhere between 10 to 20% protection, all the way up to maybe 60 to 70, if not a little bit higher. That's significant. And so vaccination, to me, and the coverage of vaccination amongst our population is a key metric for us that helps us inform the guidance we provide to places like Western.
Thank you very much, Dr. Summers. And just on that point, a reminder that tomorrow on the Middlesex-London Health Unit's online dashboard, we will be updating the vaccination information for London and Middlesex County. So watch for that tomorrow. That does bring us to the end of our questions for this afternoon's virtual media briefing. Thank you so much for being part of it. And to Mayor Holder, Warden Alison Warwick, Carol Young-Ritchie, and to Dr. Alex Summers, thank you as well, always, for your insights, your information, and your guidance as we continue to navigate the COVID-19 pandemic. That will do it for us for today. We will be back with our next virtual media briefing. That is coming up on Thursday, the 10th of February at 2 p.m. We hope to see you then. So have a great rest of your Monday afternoon, and so long for now.